going live. Going live. The code word for today is creativity. Is creativity. So that is it. There you go. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you, the trainer. Certified from Cambridge University. Bachelor of Arts in English Literature. Bachelor of Education. University 8th rank. Masters in English Literature. Masters in Education, a teacher trainer. Cambridge CELTA, Certificate of English Language Teaching to Adults. Internationally recognized certification. I'm very happy to tell you regarding my background, regarding my qualifications, academic qualification, as well as professional qualifications. Because a teacher has to have these two different things. He should be language-wise proficient and teaching-wise also proficient. There are many people who neither are qualified English teachers nor teachers at least. They just come and they don't have even a certificate in teaching. So they come and teach. So don't just be fooled, test them, go, learn, join anywhere you want. But first ask them. So ask them, find out, yes, if they are qualified teachers, yes, definitely. Join, learn, improve your skills, and everything is possible. But otherwise, Don't be fooled by these false prophets. Don't be fooled by false prophets. Go and learn from the real master. Don't come to me. I'm not asking you to come to me, please. Don't think that, okay, I'm asking you to come. Anybody else? So if you're really, because many people, I don't take the admissions unless and until they are very serious. So don't come to me, but go to those teachers who are really teaching well. Don't believe those people who say, nobody can teach you reading, nobody can teach you listening. Teachers have to teach. If they say, nobody can teach you reading, nobody can teach you listening, that means that they are false prophets. Just to throw the materials to you and say, go to hell. Okay. So they are not teachers. Teachers are those who bring people out of hell and let them dance them in heaven. Those are teachers. Because I am a teacher trainer. I am a teacher trainer. I trained number of teachers, hundreds of teachers. So teachers, if any problems are there, in education, they'll go to teachers. If teachers only can tell, nobody can teach, then where will they go? That's the biggest problem. So go to those teachers who teach you, not cheat you. So that's it. So remember, mind you, your head is going to blast. Mind the head, mind the gap. So that is creativity. Today's buzzword. Today's buzzword. Its topic is today is creativity. Everything is creativity. Everything fine. Okay. Then what you're supposed to do is, yes, I'm just waiting for another 3 candidates. 14 would be fine. So in the meantime, you write your points. What are problems you're facing? Yes. So listening subtest. Listening subtest. Part C, Jasmine Burton. Write down your points there. Jasmine Burton. Jasmine Burton. So this is taken from the official OET book. And one extract is taken, second extract of the third official test in the official booklet. Okay. So I'm going to teach you. This is for educational purpose. This is for educational purpose, to train the students. Okay. Right. So what are we going to do in listening? We are going to do pre-listening, while listening, post-listening. Now first we'll do pre-listening, because a teacher is meant to show what is pre-listening. So that is what I'm going to show you. What is this pre-listening? Let us see. Okay. Right. Now, yeah, you know, we are having regular sessions for all the possible things. And I was planning to take a session for grammar and a session for vocabulary and a session for pronunciation. So 3 sessions in all. Earlier, you know that we are taking reading, listening, writing, and speaking, the LSR 4 skills, LSRW 4 skills. LSR 4 skills. Now we are going to okay, so that's it. So last 1 minute. Last 1 minute for you to write any points, doubts, or anything. Right. Last 1 minute. Yes, here we go. Fine. Now, so the 3 stages. The 3 stages of listening. The 3 stages of listening. So there you go. Number 1, the pre-listening stage. Number 2, the while listening stage. Number 3, the post listening stage. Now there are altogether 3 different things. There are 3 different things. Yes, 3 different things. Fine. So the 3 stages of listening. The pre-listening stage, the while listening stage, and the post-listening stage. In the pre-listening stage, you are going to do a number of things. Now, what are those things? What are those things? While listening stage is totally devoid of everything. While listening stage, totally devoid of everything else. So try to understand this. Now, what is this pre-listening stage? That means the listening part is divided into 3 different parts. Every listening. There is something called 0 time, talking time. Nobody is speaking. He will tell you, now you have 90 seconds to look at the questions from so and so to so and so. From question, yes, you have this time. Yes. Part C. Okay, Jasmine, Burton. Okay, this is it. This is the thing. Okay, fine. Okay. Questions 13 to 24. Questions 13 to 24. You can see that there. Questions 13 to 24. So that means, now let me tell you one thing very clearly. I will tell somebody to note down these points which I am telling. Who is that? Can help me? Yes. If you attend this session fully, this will be equal to 10 sessions for you. So Prajna and Karuna as usual.
Yes, sir.
Important points, whichever I tell you to, like this. See, for example, pre-listening, while listening, post-listening, I have already put. So if I tell you, you note down those things. If you feel that important in your notebook, both of you.
Yes, sir.
And afterwards you have to send me because I don't have time to concentrate on two different things. So I'm taking your help. Right. Now here, you should know certain things. This is the point because I'm focusing on more important things. I'm focusing on more important things. Right. So there are many people who are taking material from our site and posting them here and there. So I'm just putting these things there because we're working hard and somebody just takes them. Fine. So the 3 stages of listening. So the pre-listening stage, the while listening stage, the post-listening stage. Why I would do all these gimmicks is, why I do all these things. And I work hard. I pay a lot of money to these websites. For example, Adobe. I pay money to Microsoft. I pay money to Zoom. I pay money to Otter. Lot of websites I pay money and I get a lot of facilities. See, suddenly it changed into different styles. Okay. From where to where it went, you see. So now here, the pre-listening stage, the while listening stage, and the post-listening stage. Automatically, Microsoft has converted into a wonderful slide for me. And somebody just takes them and they post them. That's what. And there are some people who just post in our channels. What? Leaked papers. We are working so hard and they're saying leaked papers. Okay. And people, there was one girl who literally cried, I paid 2 lakhs. I really feel very sorry. I tried 2 times, sir. I did not get the result, so I paid. Yeah, there's a fact. Innocent people are become victimized. The very sad part. Educated people are fooled. That's the point. So pre-listening stage, while listening stage, and the post-listening stage. That's it. These are the 3 stages. You have to understand this important concept. Okay. That means see, this particular extract is divided into 3 parts. Pre-listening, while listening, and post-listening. Now here, you have these questions. Extract 2 questions 13 to 24. These are about the, so here you can see these are about the question, task, about the task. So next one is about the task. Questions 13 to 24. Yes, that's fine. And this is extract 2.
Happy 30. Happy 30.
No. Okay. Right. So here, extract 2. Right. Now, this is extract 2. Question numbers 13 to 24. 13 to 24. Right? That's very good. That's very wonderful. Right. Now, when you are doing this, focus very clearly. What exactly are you going to do? In extract 2, question number 13 to 24, okay? Right. 13 to 24. What are you going to do? I'm giving you time to think. I am giving you time to think. Yes, exactly. 13 to 24. That means this is the last part of the listening. That means very tough. Very tough part. The toughest part, you can say. The toughest part. Part A is finished. Part B is 1 to 6. Part C is 7 to 24. So 13 to 24, second part. That means by now, you're coming to the last stage. Fine. Now, what are you going to use here? So what are you going to do? Now, let us see here. He is telling you these are the instructions from here to here. Copy. Instructions. So there are two parts here. The instructions. I'm going to tell you many things. Focus on those areas, all of them. The instructions. The instructions. Yes. Forget about others. You mind your business. That's it. Okay? It is your duty to learn. Okay? Right. This is the point. This is the point. Okay. Okay. So, now just to see these things. That's it. These are the instructions. Now, in the instructions, you know various things. What are those various things? I'm going to explain you here now. Now, focus on these things because these are very, very important. Okay? Now, just to go through these points. Go through these points very clearly. Now, let us see. You hear an eye specialist. So, you hear an eye specialist. Okay. So, there is an eye specialist here who is speaking, talking to a patient. We know eye specialist is talking to a patient called James Burton. This is wise. Okay. So there is an eye specialist and he's talking to a patient, and the patient's name is Jasmine Burton. And who has recently undergone eye surgery. So I told you just a few minutes back in our speaking session, whenever you have has or have or had, you have to use past participle V3. Go, went, gone. Undergo, underwent, undergone. If has is there, don't use underwent. He has went is wrong. He has underwent is wrong. He underwent or who has undergone. Now, who underwent is also correct. Who has undergone is also correct. Now, what has undergone is telling, that means recently. Who underwent means in the past. So, he is telling that this is recent happening. Recently happened. Not past, recently happened. Has undergone is present tense. Try to understand. So here what you are learning, who is speaking, number one, and with whom he is speaking, and what is the background, under what circumstances. So this we know. Who is speaking to whom, about what and when. So who, whom, what, when, where, why. These are the important things. So these words should come into your mind immediately. So the authority is the eye specialist. And then you have the patient, Jasmine Burton, a lady who has recently undergone. Recently, you see there, recently. So present perfect. Whenever you use the word recently, you have to use present perfect. Whenever you use recently, you have to use present perfect. You cannot write in past tense. Who has recently underwent is wrong. So it is present perfect. Yesterday, then you have to say underwent. Yesterday, he underwent. Last week, he underwent. Last year, he underwent. But recently, has undergone. So it is present tense. Remember that. So time is also known here. When? Recently. Okay. What is the condition? Eye surgery completed. When? Recently. Who has undergone? Jasmine Burton. Who is Jasmine Burton? A patient. And who is talking to the patient? An eye specialist. Do you know his name? No, we don't know. That's it, finished. So the first sentence will talk about who is talking, with whom he is talking, why he is talking, this is called background reporting. Reporting the scenario. That means information, background information regarding the dialogue. So first sentence will always be background information. Instructions are related to information. So first sentence is, what is it all about? First sentence is, what is it all about? And second sentence is, what you have to do. What you are supposed to do. First sentence is, what is it about? What it is about. And second sentence is, what you are supposed to do. It is instructing you to look at questions 13 to 24, bold only. That is the boundary line, don't cross. So questions 13 to 24, that means don't go back, don't go after. Now what you have to do, how many questions are there? 13 to 24, that's it. Right. So for questions 13 to 24, what you are supposed to do? So I'm just giving you an idea to you. So the same thing, okay? So it's the same thing. Whenever you get part A, you have to take like this. I'm going to take number of things. This is a mega session. This is a mega session because there are many students who are going for the exam. Let me see how many students are going for the exam today, this week. Raise your hand. Raise your hand. Those who are going for exam, raise your hand. On 19th. So I'm taking part A, I'm taking part B, I'm taking part C, everything. Okay. Lot of things I'm going to explain. This is on demand lecture. Okay. Fine. So Jasmine, Burton, from here we are starting now. Yes. So, how many questions are there? 12 questions are there. What you should do? You should complete the notes. That means incomplete notes, notes completion. It is incomplete. And how you have to complete? You have to use one word or a short phrase. You have to use one word or a short phrase. This session is going to be in 3 parts because this is a workshop. This is a workshop. First I am taking part A, then I am taking part B, then I am taking part C. Yes. Now let us see. And the last one is information regarding time. First one is information regarding background. Second one is information regarding what you are supposed to do. Third one is information regarding the time. Now, what is this all about? So, first sentence, background. Second sentence, your action. Third sentence, the time bound. You have 30 seconds to look at the notes. 30 seconds. Now, 30 seconds is a very big time. 12 questions and 30 seconds. What do you mean by that? 12 questions and 30 seconds. That means each question 2.5 minutes. Each question 2.5 minutes. That means how much? 60, 60. Now, try to understand here. 30 seconds. So 2.5 seconds for each question. 12 2s are 24, 2.5, 30 seconds. Very fast. Now what are you supposed to do here? You now have 30 seconds to look at the questions. "30 seconds to look at the notes." What do you mean by look at the notes? Do you understand why he is telling look at the notes? Means go through these notes. Do something. And you have to complete the notes with a word or short phrase. Questions 13 to 24. These are the number of questions. Only these are important. Has undergone means recently only, nothing else. So that's it. And he will be silent. Now there are 3 teachers for you. One teacher is Mr. Simon, who is teaching you. Another teacher is the question paper where somebody has given you instructions. Another teacher is the audio where the same instructions are repeated there also. If you miss on the paper, you will listen to the audio. If you miss in the audio, you'll read from the paper. So remember that, it's very important. So immediately when you hear an eye specialist, immediately everything related to eye specialist should come into your mind. You have to construct, you have to build the scenario. And the patient is their lady, and you are the specialist. Like that you have to feel. You have to step into the shoes of the eye specialist. Eye specialist means what? Ophthalmologist. Is that so? Now what happened? Surgery is completed. Now what is he going to tell now? Finished everything. Maybe post-operative care, maybe follow-up activity, or maybe related to medication, maybe the pain he's facing, or whatever it is, they will be discussing these 2 things. 30 seconds. Now what you have to do in these 30 seconds? This is called pre-listening. This is called pre-listening time. 30 seconds is pre-listening time. Do you know that before the audio starts, you are going to look at the notes for 30 seconds. That is what we are going to do now. Many people, what they do, the audio did not start. 30 seconds. Who is there in the room? Who is behind me? Who is next to me? They will see here, they will see there. Where is the invigilator? How many candidates are writing the exam? All these nonsense things they will do. Don't they know that they have to go through the notes? They have to skim and scan the notes? Fine. Right, this is very important now. Now, I'm showing you here these things. Okay, where is this? Yeah, here it is. First one is related to specialist. This is about the discussion, background. First sentence is the background. Number 1 is the background. Background to the discussion. Number 1 is the background. Number 2 is your plan of action. your action, what you are supposed to do. Number 3 is the time limit, the time factor. So now these are very, very important. Yes, these are very important. The background story, your action, what you have to do, the time, how much you have, and what you are supposed to do. So this is called a pre-listening task, pre-listening stage. If you can analyze this one, it is very easy and you will not miss even a single point. Even a single point, you will not miss. Right. How are we to go about this? I'm showing you now. Bear with me, please. If you cannot understand this, you cannot understand part B. If you cannot understand part B, it is even difficult for part C. So that's why I'm explaining you these things. Because these are easy. I'm going from simple to complex. Everyone, when I ask what should I teach, they'll say part C. They'll say part C. But you are going to fight the champion. Okay, Olympic champion. You are going direct attack to Olympic champion before you are fighting with the street fighter in your village. First fight this person in your village champion. Then go to the country champion, national champion. Then go to the international champion. Nah? You want to see part C directly? Do you think part C is so easy? You don't know part A only how to do properly. Why sir told you I'll take C, but why sir is starting with A? Right, that's it. Now let us see here. Now write down the points. Number 1 is skimming. Number 2 is scanning. These are enough. Skimming and scanning are enough. No need anything, no reading at all. Now what is skimming, what is scanning, I'll tell you now. What is skimming and what is scanning? You should realize. Now, why are you skimming? If I tell, I am skimming important. What are important? Nobody will tell again. Okay. What are important things? Nobody will tell again. Okay. Nobody will tell you what is important. Fine. So you have to realize that. Okay. There's something important. Now write down skimming and scanning. Skimming and scanning. Fine. Okay. Right. Now let's move ahead. Next point. Sorry. Okay. Right. The first stage, the skimming stage, pre-listening here. Okay. The skimming stage. Okay, I'm coming, Karuna, 1 minute. The skimming stage. The skimming stage. Okay. So in the pre-listening, we have the skimming stage. What are you going to skim? Number one, the headings and the subheadings. The headings and the subheadings. The headings and the subheadings. So when you are skimming and scanning the headings and the subheadings, then automatically, fine, you will get the most important things. The most important things. Right. Now, what are these most important things? Okay. The headings, I'm going to show you now. I'm going to show you the headings. Now, what are these headings and what are these subheadings? Immediate first thing you have to focus is this only. The first thing you have to focus on is this. Now let us see what are headings. Headings are here. Okay. So headings and subheadings. The patient history, surgery, and presenting with what problem. That's it. So here headings and subheadings is everything here itself. Because there is no heading, so just subheadings are there. What are the subheadings? Patient. So who is the patient? Patient history and surgery. Presenting with what? So now there are 4 subheadings. There are 4 subheadings. First one is patient Jasmine Burton. That's okay. Patient history. This is history. History. Okay. This is surgery. This is recent one. Surgery. Next, this is presenting with. Okay. What problems? What difficulties or what ailments? So 4 different things are there. First one is patient. Nothing is there in that one, so forget that one. So there are 3 parts. History, surgery, and complaints. History, surgery, and complaints. Now, what are the histories? You can see there. So now, these you have to go through. This is called skimmings, headings and subheadings. Headings and subheadings. Headings are not there, so subheadings, that's all. So there are 3 subheadings here. For this question, there are 3 subheadings. Okay, the 3 subheadings. Subject is only one, that is patient. The 3 subheadings under the patient. Patient, let us see, patient, patient's history, patient surgery, and patient's complaint. So patient is the heading, you can say here. Patient, that heading is Jasmine Burton. This is the heading. So we can consider like that. Okay, fine. So the main one is the heading. So you can say this is the heading, right? This heading, fine, that's it. The heading is, okay, patient, fine. The patient. Right. The heading, you have just taken that. Okay. The patient. You have got the patient. That is the heading there. Nothing else. Nothing else. Right. Yeah. So, if this is the point, then you have two things to do. So, focus on only these two things, please. Focus on only these two things. How are you going to focus on these two things? Okay. So, how are you going to focus on these two things? Now, let us see. So, the name of the patient, you know. Now, the name of the patient is only one thing. So, that is what you are going to see. She is a lady. What is her name? Jasmine Burton. Yes, Jasmine Burton. Right. Okay, fine. Fine. So Jasmine Burton. That's the patient is Jasmine Burton. Now, so think the patient's name is Jasmine Burton. Immediately your mind should fix. So this patient has a problem. She went to the eye specialist. She has undergone, okay, eye surgery, print screen. Now, next stage is scanning. Now, what are we supposed? I'm taking time to explain you, because if you don't understand in part A, you will never understand in part C. What is skimming? It is better to learn here itself. So, next one is the three subheadings. The three subheadings. What are the three subheadings? Remember here. The three subheadings are patient history, surgery, and complaints. Number one, so history. Number two, surgery. Number three, complaints. Right. So, right, the three subheadings. The three subheadings. Yes. The three subheadings: history, surgery, and complaints. Now he is going to tell about the story, how the story developed gradually. So after that, he has undergone a surgery. After that, he has some problems. So it is progressing step by step by step. I hope you can understand it very clearly. Fine. So these are called subheadings. So now let me ask the students who are participating. Okay. Now, are you with me? What do you mean by are you with me? That means, are you okay? Are you following me? Are you able to understand what I'm telling? Am I talking sense? Are you able to understand what I'm telling? That is the point. Yes, please. Okay. So, if you have any points, please write here 1 or 2 sentences. If it is a very serious problem, you raise your hand. Because this is a workshop, a lecture. At the end of the session, you will have, question answer session. But now this is a one-way lecture, and unless and until it is an emergency or something is really serious, I will not allow. So that is the point. If it is really serious, just message me your point, then I will definitely answer your point. First, let me know, because I'm in a deep point, depth. Yes. Okay, please. And thank you. Okay. I'm trying to be kind to you, good to you. I'm not rude. I don't want, because it is too many cooks spoil the broth. This is not a discussion session. So that way, if you have any points, please write down, because this is a workshop. Okay, right. Fine. Now, next one is, now we are going. So what? So skimming is done. The skimming stage is done. The headings and subheadings. So these are the headings and these are the subheadings. Now let us see skimming stage. In the skimming stage, okay, this is the skimming stage. You have the headings and you have the subheadings. You have the headings and you have the subheadings. Okay, right. Now let us see next the headings of the heading. The patient and her name is Jasmine Burton. Finished. And the subheadings, there are 3 subheadings: history, surgery, and complaints. Now we are going to the scanning stage. Next one is the scanning stage. Very fast we are moving now. So, next one is the scanning stage. The scanning stage. This is number 2. Yes. So these are very important, because part A, it will transfer to part B, part B, it will transfer to part C. So scanning stage. In the scanning stage, you are going to do 5 things. Simon's left hand rule. First one is the names. Second one is the numbers. Third one is the new vocabulary. Fourth one is the difficult vocabulary. Even in reading also the same thing. Okay. Listening also the same thing. This is reading comprehension or listening comprehension. Comprehension is comprehension only. How well you are able to understand. And the last one is the special words and the phrases, or you can say the special phrases. So these are the 5 different things you should know. The 5 different things. There are the 5 different things. It's very, very essential. The scanning stage, you have these 5 components. The names, The numbers. And the new vocabulary. The difficult vocabulary. And the special words and phrases. That's it. These are the 5 different things. Yes. These are the 5 different things. Yes. We go step by step in this order. First we will see the names, then we'll see the numbers, then we will see the new vocabulary, then we'll see the difficult vocabulary, then we'll see the special words and phrases. I want dark. Okay, fine. So we have the 5 things. We'll go step by step. The scanning stage, we'll go step by step. So names are very important. How do we identify the names? The names we can identify by the capital letters. Write down Karuna. The names you can identify because of the capital letters. Okay. Because you have to go very fast. You have to go very fast. You don't have time. You have only 30 seconds. In 30 seconds, what all you read. So just go through these things. You will finish in 15 seconds. An expert will need just 15 seconds. But you have 30 seconds. Remember that. You have 30 seconds. Names. Okay. Names. Now, you have names. How can you identify these names? One by one we'll see now. You can identify the names because of the capital letters. Now let us identify the names. Now let us identify the names. Are there any names? Are there any capital letters? Yes. Jasmine Burton. Capital letters. J and B capital letters. February. Name of a month. It's very important. Capital letters. It will help you. Only 1 month is there. February. Very good. February. Right. So names of the month. There are many people who don't write capital letters for a month's names and week names. They have to write capital letters. It's a must. So finished. How much time will you take? 1 second and 1 second. Nonsense. So simple as that. James Burton and February. Finished. That's it. Next, second one. Numbers. Numbers you can identify their shape, by their shape. Names you can identify by their capital letters. Numbers you can identify by their shape. They have peculiar shape. Very easily you can identify. See, if you cannot identify here, how can you identify in the big passage, big paragraph? Okay. Now see, how are we going to identify the numbers? Now let us see here. Anywhere numbers are there? No. Only these question numbers are there. Question numbers are there. Okay. Otherwise, no numbers. No numbers. Here it is there. 6 months. 6 months. Along with 6, there is months. Important. Underline, it's very easy. 6 is very easy to identify. They stand distinctly different. Names and capital letters stand like kings and queens. Whereas numbers, they are peculiar. Okay. They're easy to notice. So next. And next one. Next one, okay, The new vocabulary, the difficult vocabulary, and the special words and phrases. These are because of size. You can identify them by their size. New words will not be small, like on, in, off, with, the, from, to, between, beyond. They are not small. New vocabulary, first time you are seeing some words, they will definitely be very big, huge size, gigantic, broad letters, broad words, lengthy words. Difficult vocabulary are also lengthy words. Special words and phrases, 2 or 3 difficult words, or 2 or 3 new words. So those are special phrases. So first one is related to capital letters names. Second one is numbers. Third one is because of vocabulary, that is size. So this is how you are going to identify things. That is the point here. So now what is the probability of getting the marks? I'm going to tell you what is the probability of getting the marks. Now let us see. Number is there here. Okay. Number is there here. Okay. Remember this number. Right. Next one. Now capital, big size, we told size. Now see, astigmatism. Maybe it is a new word or is a difficult word for you. New word or a difficult word. Anesthetic, big word. Okay. Anesthetic, the big word. Next one. In this one, the big word is problems. The problems. In this one, problems. Okay. Next one here, slowness. And here the word is perception. Perception. And here works. Big word in that part. Only one, see, nothing, only one word you find in each answer. Astigmatism, anesthetic, problems, problems. Okay. So 2 problems. We'll come back later because these are confusing. Definitely here there will be some confusion. Next one. Then slowness, perception, works. Then here 3 years ago. 3. Number may be in word form or number form, digit form. Okay. Then next one, capsular. Capsular dash. Or post-operatively. Examination. Examination. Increase. Sensitivity. And here also increased. So here is sensitivity, here is number. So confusion, increased number, increased sensitivity. So sensitivity, increase is not important now. Here number is important, here sensitivity is important. Sensitivity to what? Number of what? So that is more important. So this is a danger. Increase is a trap. Red mark. Increase is a trap. So that's why. So in the same way, here also there is a trap. What is that? Problems, a trap. To confuse you. Problems, confuse. So now here lack of means shortage. Okay. Result from a lack of means cause. Some deficit. And this is mean. Mean means signs and symptoms suggestive of. So that is the clue. Mean means, it means what? Implies what? Suggests what? Implies or suggests what? What does it mean? Signs and symptoms are suggestive of. Side problems mean what? The next one, lack of means drawback, deficit, shortage. Write the synonyms, learn. Same word will not be there. Some other word will be there and you should be ready to catch. You should be ready to catch the words. So these are very, very important. And next, that is it. So these are very important things. Now let me show you here. Let us go to our PowerPoint. Again. Now here, number 1 is the names. Now how are you going to identify these names? You are going to identify these names. You are going to identify these names because of what? Bullet point number 1. The capital letters. The capital letters. And the second one is, these will produce you 50% of the answers. They fetch you 50% of the answers. If you can understand these two things, you can notice by capital letters, number 1, and you will get 50% of the answers because of these two things. Because every other question will be related to some name or the other. Without any noun, there will not be anything. So 50% of the answers, every other question is related to names. So names are very, very important. Names are very, very important. So what are you going to do with these names? What are you going to do with these names? Fine. Okay. Right. Sorry. Okay. So, capital letters, and you're going to get 50% of the answers. Then see how beneficial it is. Next, number 2 is numbers. Point number 2 is numbers. Now, what is the benefit of numbers and how to identify these numbers? Right. Number 2 is numbers. And the benefit of this one is the peculiar shape. And you will get 20% of the answers because of numbers. 20% of the answers you will get because of numbers. Because you see, these two things together will give you 70% of the answers. 70% of the answers. It's not a joke. So why don't you worry about these things? Identifying these things are very important. Part A or part B or part C. Okay. So identify these things is very important. So 50 plus 20, 70%. 70% of the answers. Then remaining 30%. Remaining 30%. Okay. 3, comma, 4. Okay, 3 to 5 we'll write together. 3 to 5. 3 to 5. Okay, no, let us take it separately only because it's very important. I'm going to explain you that. So, why these 3 different separately I gave you, I will explain because you did not attend this session before. 3. The third one is new vocabulary. New vocabulary. New vocabulary, you recognize them by their size. Gigantic size. And you'll get 10% of the answers. Now, what do you mean by this new vocabulary? That I have to tell you here, an additional point. An additional point. These words you are noticing for the first time in your life. You are noticing first time, novel experience. First time in life. So these words you are learning for the first time. For example, I'm going to give you a word now. If you know this word, you say yes. I'm going to type the word here in the chat box. Okay. But before that, okay, I'm going to give you an example here. Example. Okay. Now this is the example word. The word which I gave you as an example. Now this word, if it is given in the question, then what you are going to do? If you don't know the meaning of this word. The word is simultaneously. Now what I want you to do is, if you know the word, you say, if you know the word, right? Simultaneously. If you know the word, you say, I know. That's all. If you don't know, you type, I do not know. Finished. Because I'm going to teach you what is the difference between new vocabulary, difficult vocabulary, and special phrase. Because these 3 types of questions are there. These are very, very difficult because questions, reading is mainly, listening is mainly focusing on vocabulary. If you know, otherwise you can say yes or no. If you know, say yes. If you don't know, you say no. Simple. So that's it. It's come on fast. Now this is called new vocabulary. Why you don't know, I'm telling you. This because of 5 reasons. Simultaneously means, okay, now those people who know, write your answer and write the answer and keep it there. What is the meaning of simultaneously? Write and keep it there, don't submit. Write and keep it there. When I tell you to submit, you submit. Write and keep it ready. Okay? I'll ask you, I'm giving you 1 minute to type and keep it ready. In the meantime, I'm going to show you something. Okay. How can we differentiate these words? Why are we supposed to learn these words? Because simultaneously is not an ordinary word. Simultaneously is not an ordinary word, it's a special word. That means if you know that word, that means you are an expert. Sorry. Yes, new vocabulary. Okay, right. Vocabulary is divided in based on whether a word, so vocabulary features. Vocabulary features, features of vocabulary. Vocabulary related features. Okay, I'm also creating some new phrases and new things. Right. Now, there are 5. Number 1, the first one, regarding vocabulary, you have 5 specific things. First one is the spelling. So, do you know the spelling? Number 1. Number 2, do you know the meaning? Number 3, do you know the pronunciation? Number 4, do you know the derivatives? Or you can say the word forms. Then number 5, the usage. These are the 5 distinct features of vocabulary. These are the 5 distinct features of vocabulary. That's it. So, do you know these things in the first place? Do you know these 5 different things in the first place? If you know these 5 different things, that means you are an expert. You know these words. Okay. Spelling, you can learn from Cambridge Dictionary. Meaning, you can learn from Cambridge Dictionary. Pronunciation, you can learn from Cambridge Dictionary. The word forms, you can learn from Cambridge Dictionary. The usage, you can learn from Cambridge Dictionary. Go to Cambridge Dictionary for anything. If you know all these things, then it is okay. Active vocabulary. You know all these things and you are using them in everyday life. You know all these things. So known vocabulary. If you know all these things, perfectly known vocabulary. And if you don't know all these things, then it is new vocabulary for you. If, for example, there are some students who said, I don't know these words simultaneously. That means you don't know its spelling, you don't know its meaning, you don't know its pronunciation, you don't know its word forms, you don't know its usage, because never in your life you heard this, or read this, or noticed this. That's it. First time you are facing this word, it is called new vocabulary. That means deadly word, dangerous word. So such words are very important. Many words you are seeing, you don't even bother. Why are you not going to the father? Cambridge Dictionary. Yes. Cry there, you will get all these things. You will get all these things, definitely. So that is what it is. No need to read, study 10 examples, 10 lectures. No need. One grandmaster class is enough. One class. There was one student today, I gave 3 places. One place is already occupied. She came to me. She said, I will join, sir. She joined. She told me what? 4 months back, I came to you, sir, but I did not join your sessions. Okay. I knew that yours is little difficult and tough. I went here and there and I studied. I went to you. I spent 1 lakh rupees and more than that. And I'm depressed, sir. I swear this is the truth. I don't want to take the name of the candidate. Okay. I said, I'll bless you. Come on, we can join. Because I see the pain in your heart. I gave her admission. So that is what it is. Today, there are messages in my WhatsApp. I will not show you, but they are there. You know, I know you trust me because I am a very serious person. I don't tell, just I don't need. Okay. That's the fact. Many of you know me, what I am, how much a dedicated or serious person I am. You see many teachers. Are they ready to take at your own convenience time different? Yes. They take your admissions and give to somebody and those people will not teach you properly and you're crying in pain and nobody is bothering. The person who is taken your money is not teaching you and the person who is teaching did not take your money. He gets his salary, he gets his profit and you are the loser. Okay. So I'm telling you so I want you to understand the importance of these things. Learn these things and apply them in your daily life. I take pains to see how much I am taking. Okay. How much my mind should be active to practice all these things. I don't give my students to anybody. Only I will teach, nobody else. Okay. So, because I have seen number of people, they are least bothered about, they don't have that passion in teaching. Okay, fine. So, learn these things on a daily basis. When you see a word, go there, underline, and learn what it is. Okay? You may see a new word with first time in your life. Underline that, go to the dictionary. Where is the time for us, sir? If we just pass, that is enough. We are not going to use this in our daily life. So much pessimism, so much negative attitude, reclusive, disinterested. Why? Just to pass, you are doing the OET? You don't have passion to learn the language. You don't want to learn the language and you want to go to an English speaking country and you want to work there? Huh? You don't want to prove that you are expert in English? That is why they are taking these tests. That is why they are failing you. Huh? Don't play the fool with yourself. You are not fooling anybody. You are fooling yourself. Remember that. So, if you know everything of these 5 things, it is known vocabulary. If you don't know anything of this, it is new vocabulary. Okay. Now you know 1 or 2 or 3 or 4, then it is difficult vocabulary because you don't know its spelling or you don't know its meaning or you don't know its pronunciation. So that is why it is difficult vocabulary for you. Pronunciation is difficult or meaning you cannot understand or spelling you don't know how to write because you don't know how to write. The other person will not give you mark. The word forms, where to use simultaneous and where to use simultaneously. Word forms. Okay. Simultaneously. Yes, now I am coming. Now you have typed the word and kept it there. Yes, ready. Right types. 3, 2, 1. Submit your answer. What do you mean by simultaneously? Yes, 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 yes. There are many meanings. Parallelly, at the same time. collaboratively, combinedly, together, jointly. Yes, Karuna. Second time you are raising your hand, so I'm asking you. Okay, no problem, Karuna. You can unmute. I think there is something urgent. Yes, Karuna, tell me.
Hello, sir. First time I had raised hand as you asked that who all are appearing on 19th, and this time it
Okay.
was by mistake.
Okay, no problem, no problem, no
Yeah.
problem. Only if there is a serious problem. Okay, I myself gave a wrong hint. Okay, no problem. I'm sorry. Okay,
No, no.
right. It's okay, it's okay, it's okay. We are moving forward because it's I will lose my track. That's why. Okay, happening at the same time, the same time, the same time. Yes, very good. So now I want to ask you one thing. Okay. So these things are very important. If you don't know anything, so actually they are testing whether you know the spelling, they are testing whether you know the meaning, they are testing whether you know the pronunciation, they are testing you know the derivatives of the word forms, they are testing whether you know the usage or not. That is what it is actually indirectly. Okay. If you don't know any of these five, it is new vocabulary. If you know one or two and the remaining you don't know, it is difficult vocabulary. And you know everything, that means you are an expert. That's it. Fine. Absolutely. So fourth one is difficult vocabulary. Now what is this fourth one, difficult vocabulary? So difficult vocabulary. Yeah. So this is, maybe do not know any one particular thing. Okay. You don't know one particular aspect or two or three. You don't know everything. Partial knowledge or half knowledge. Partial knowledge. Half knowledge is dangerous. Partial knowledge. That is why it is difficult. You know the meaning, but you don't know the pronunciation. Okay? You don't know the meaning. Then you don't understand. Okay? Simultaneously, if you don't understand, the question is asked for this only. So what is the meaning of this? That's the point. Parallelly, at the same time, together, collaboratively, jointly, unitedly, okay, in collaboration. So these are different meanings you can use. But actual meaning is simultaneously, means at the same time. Others are synonyms. Only one meaning you will have. Others are synonyms. At the same time is the meaning. So that is difficult vocabulary. You have 10%. Okay. 10%. There's the fourth one. And the fifth one is, special phrases. Special phrases. Now, what are these special phrases? They are like idioms, worldly saying. Okay. Okay. This is called expert usage. Dance the tide. What do you mean by dance the tide? I was telling you, dance the tide. Can you dance the tide? Means fighting against odds. What do you mean by fighting against odds? Face the challenges. What do you mean by face the challenges? What does it mean? Okay. Never turn back to adverse conditions. Same thing. Same thing. Okay. Turn back. Never turn your back. That means fight. Same thing, never turn back. What do you mean by never turn back? What does it mean? What does it mean? Special phrases. The real meaning is different and the intended meaning is different. Don't break your head. Means what? Are you really breaking your head? What do you mean by don't break your head? That means don't waste your time thinking about it. It's futile. It's futile. That is it. Don't break your head, my child. What do you mean by that? Don't break your head. Is Simon mad to use the word don't break your head? Mind the gap. Mind the gap. Okay. Read between the lines. What are these? These are special phrases. What do you mean by read between the lines? That means underlying meaning. The original word is something and you have to, oh ho. What do you mean by oh ho? That means, is that so? Means I'm surprised. Wow. Means that's wonderful. Read between the lines. Means it's paining. It's aching. I'm in trouble. The more the sound, the more the pain. That's it. A dancer who doesn't know how to dance blames the floor. Oh, it is very difficult. Oh, it is very difficult. They are making money. A dancer who doesn't know how to dance blames the floor. Nachna ave angane teda. Punjabi quotation. So now, what do you mean by this? It means that a person who lacks knowledge blames on something else. He cannot shoulder the responsibility. A person who is successful will shoulder the responsibility. What do you mean by shoulder the responsibility? It is a special phrase. It implies something. Shoulder the responsibility means some responsibility is there. You are putting on your shoulders. What do you mean? It is responsibility is not a trunk box or a suitcase which you put on your shoulder and carry somewhere. Shoulder the responsibility means what? You understand? The intended meaning is something different. That means there is no escape. You cannot avoid. You have to. It's a must. That's the meaning. You must do it. Shoulder the responsibility means you must do it. So that is special meaning. You should understand that special meaning. Right. So, for example, let the cat out. Okay. Who will bail the cat? The other day I was teaching. Right? No man's island. No man's island means deserted place. Right? It's not my cup of tea. What do you mean by not my cup of tea? I'm not interested in that. Football is not my cup of tea. Mathematics is not my cup of tea. So that's it. Fast food, I will not give to my children. You are my children. Fast food, I will not give you. Come on, take this, do, and tell me the result. No, I'm explaining you. I'm explaining you how to do reading. I'm explaining you how to do listening. These are very important. You are going to scan these things now. You are going to scan these things now. So that is what? 5 different things. Names, numbers, new words, difficult words, special words, and phrases. These you have to scan. Okay. Right. Now, once you scan these things, you'll get an idea about this. suffers from dash astigmatism. What type of astigmatism? Astigmatism, type of astigmatism, maybe. Okay. Serious, mild, moderate, or something like that, maybe. Adjective is coming here. Remember, astigmatism is a noun. Now, next step. Suffers from what type of astigmatism? Suffers from headache. What type of headache? For example, headache is there. Suffers from headache. What type of headache? Mild headache, moderate headache, panic. Okay, sorry, moderate headache, intense headache. What type of headache? So noun is there. Before the noun, adjective will come. So now you understand astigmatism, you underline. So it is a noun. So the word before should be from dash type of astigmatism. So type. So what are the adjectives? Write down. Nouns. Underline these words. Underline. Okay. It takes time. If it is not your cup of tea, you can leave. No problem. Peter sir doesn't mind. It is not everyone's cup of tea. Number one, these are called content words. So number one, what is number one? Number one is nouns. Number two, adjectives. Number three, verbs. Okay. These are very, very important. These are very, very important. So now this is a noun. Astigmatism is a noun. If it is a noun, the word before noun will be adjective. So the word before noun will be an adjective. Adjectives are different types. Adjectives of quality, quantity, number, size, shape, type. Different types of adjectives are there. So mild, moderate, severe, or something, or maybe something else. Now I am going. Activate your vocabulary. Come on, guess. Type. Type your answer. What type of astigmatism? Come on. Think. Reason. Reason. Bring out all the words in the world which you can realize and write. Blast your brains. Brainstorming. Suffers from dash astigmatism. What happened? Are you not able to hear me? What word may come here? Think. Be ready. Eye surgery. What words you can use? Write down. Whatever you want to write, you can write. Come on, fast, please. What you can guess there? Come on. So chronic astigmatism, very good. Eye astigmatism, compound noun. Severe astigmatism. Don't write capital letters, please. Don't write capital letters, because don't take the habit of capital letters, because these are bullet points. If it is a capital letter, it's a wrong answer. You lose your mark because you don't know what is punctuation. Don't think that because spelling is correct, you'll get the mark. No. Yeah. So, now next, also has a dash, has verb, he has a pen, he has a book. Okay. So noun will come. So here has is a verb. After a verb has something or has someone. He has something. So surgery is done, something. So verb is there. So after verb, there will be a noun. Verb plus noun relationship here. I'll put it down. And here it is adjective plus noun relationship. Adjective plus noun relationship. Adjective plus noun relationship. You can take that. So also has a dash. So surgery under general anesthetic. Also has dash. So surgery. What he has is undergone eye surgery. So also has a dash. So surgery under general anesthetic. What are the possible options? Come on, type. Question number 14. What may come there? Also has a dash. So surgery under general anesthetic. What may come there? Has a something. Okay, cataract. Undergone will not come. Undergone is a verb. Okay. He has something. He has something. So because noun, without noun, something has undergone, then again what? He has eye condition. What eye condition? He has cataract, blood vision. Okay. Nystagmatism. What is nystagmatism? Okay. Astigmatism. Okay, fine. Cataract. I don't know what is nystagmatism. I think some medical term. Okay, maybe. I'm not sure. So squint, glaucoma. Come on, think about what all possible. So this is how you are brainstorming. Brainstorming is very important because this is comprehension. Next, we'll go to the next question. Eye problems may result from eye problems. For this person, eye problems may result from a lack of something. Lack of something, caused by lack of something, deficit. Okay. So question number 15. Lack of means drawback, deficit. So lack of pigment. Okay, why capital letter? Pratnya, write again without capital letter, please. How can you write capital letter, my dear? Vit A, what is Vit A? Vitamin A you write. No, these shortcuts are not allowed. Shortcuts, don't use shortcuts, please. Okay, pigment, yeah. Capital letters are not allowed. Because they are bullet points. See, where are capital letters? Nowhere capital. Then how come you are using capital letter? Vitamin A is capital letter, okay. A is capital letter. That's compulsory capital letter. Okay. Vitamin no capital letter. A is capital letter. Because A, B, C, D capital letters. Yeah. So that is it. Then next. So lack of. Lack is noun. Because A lack of something. Yes, that is. Nystagmus is a dancing eye. Okay. Right. Next one is number 16. 16. Now, sight problems mean something. Sight problems mean dash isn't an option. Something isn't an option. Something is. Sight problems mean something isn't an option. What is that something which is not an option? What are the possible options? What are the possible remedial options? Maybe spectacles, maybe contact lenses, maybe glasses. What sight problems means dash isn't an option for her. Surgery. Okay. So fine, that's very good. Something isn't something. Verb, before the verb there will be a noun, isn't an option, again a noun. So right. Slowness reports some slowness to something. Slowness to something. Slowness is noun. To something. To is a preposition. So before and after to, before and after prepositions, you will have nouns. Slowness to something. So question number 17. Slowness to something. What is that something? Guess. Guess. Okay. The next one. Has a poor perception. 18th one. I'm going to sit all night today. I'm going to sit all night today for the exam going students. How many of you are there? Raise your hands. Yes, Evelyn, Susan, Pradnya, Karuna. Yes, those who have booked the student exam. Okay, fine. So I'm going to sit all night today, especially for the people, okay, who are from the Eastern countries. Yes, it is a dinner for me today. Okay, right. Now, next you see slowness to something. Slowness to something. Yes. So here, all of you write down your test dates here. Those who have booked, write down your test dates. Those who have not booked, say not booked. Right. Test dates. So, perception of, preposition of something, to something, of something. Remember that. So, after a preposition, noun will come. Lack of something. Side problems means something isn't, something is not before a verb. Noun. Slowness to something, to something. Perception of something. So, of is a preposition. Whenever you have a preposition, after that you will have a noun. Something. Has poor perception of something. Next one, works as a. Is an article. A and the. After these words, you will have a noun. A doctor, a typist, a computer operator, a systems analyst, a lawyer, a judge is not a engineer. So you know that a is there. So vowel sounding beginnings will not start, will not be used here. Engineer, no way. Because a engineer doesn't match. An engineer matches. An engineer. If it is an engineer. A officer, no. An officer. An ophthalmologist. An official, an officer, an engineer. Okay. So A, vowel sounding beginnings. Sound. Typist, a typist. So there is a clue. A is an article. A is an article. So the next word will be a noun. That's it. Works as a professional. What is the profession? A lawyer. Okay. A lawyer. A doctor. So a nurse. A midwife. A helper. So like this. So what will be there? After article, Karuna. Are you writing? Are you writing Karuna? Okay, in your notebook. After article, you will get a noun. After preposition, you will get a noun. Before preposition, you will get a noun. So these are the things which I asked you to write. Please try to do that favor for me. Because I'm focusing on something different. Thank you. And the remaining students, what you do is you guess the words and write here. And you also, Karuna, you also write here. But whenever you see something important, you can write there. Okay, next one. Here. Next one is, so you can relax a little bit here. And see, these three come first, but here little time is there. Next one, the surgery. Surgery. Now let us say surgery. Dash in right eye. First noted. See, in the question paper also there is a mistake. The right eye. Dash in the right eye. The right eye, the left eye, body parts. Okay, human error. Somebody has made this question paper. Nobody is a master. The right eye, dash in the right eye. Remember that. Whenever you have a body part, you have to use definite article the. Body parts must use definite article the. The right, the left leg, the right leg. The right eye, the left eye, the right shoulder, the left shoulder, like that. So dash in is a preposition. Before that there will be a noun. After that there will be a noun. But before noun there will be an adjective, that is right. Before right there will be an adjective. Article is an adjective. Adjective of number. The means one. A means one. And means one. Article, number. A and the are articles. Articles means number. It's an adjective itself with a special role. So, pain in eye, something like that. Okay. So whatever it is, something, noun, something in eye. Which eye? Right eye, adjective. So in, before noun, after noun. So after the noun is I, before the noun is something. What is that something? Now question number 20. Guess. What can you write in question number 20? Swelling, very good. No capital letters, cataract. Next, what more? What more? First noted 3 years ago. So guess, inflammation, very good. Right, guess whatever. Activate, brainstorm. Brainstorm. Yes. Conjunctivitis. No capital letter. No capital letter. Because it is in the beginning, but still no capital letter. See, some. No capital letter. So you are not supposed to write capital letter. So remove it. And write again. Crusty, sticky. Crusty and sticky are no. Crusty is something. So it's an adjective. Okay. You cannot write crusty or sticky. Okay. Crustiness or stickiness or something may come, maybe. Okay, crust. Fine, like that. So you have to think about that. Next. So noun will come here before pronoun. Preposition. Preposition joins. Preposition joins. Okay, computer self-correcting. Okay. No problem. If self-corrects, okay, you are writing from computer. So before posting, you can just check and retype. So computer will not. Yeah, thank you. No problem. No problem. Okay. So, preposition. Before and after a preposition. So, pen in purse. Pen in purse. Book on table. So, before and after preposition, you will have nouns. Okay. Chitra, glugoma. No need capital. No need capital. Okay. Remove capital and write again. Those who have written capital letters, you can try removing, learn new things. How to eliminate capital letter, learn, no problem. So next one. So next one is 21. Some capsular dash. Some capsular dash noted. Noted is the verb. Before the verb, noun will be there. Some, adverb, capsular, adjective. After an adjective, there will be a noun. Some clever boys. Some intelligent students. So some is plural. So plural will be there. Or maybe uncountable also may be there. Some water, uncountable. So now what? Some capsular dash noted post-operatively. Some capsular. What is that you are expecting here? Okay. Aruna, degeneration. Okay. So what you are expecting there? Noun will come. Okay. Think about post-operatively. Some capsular dash noted post-operatively. So noted is a verb. Verb. Before verb, you will have a noun. After adjective, you will have a noun. Take the word before or take the word after, they will tell you what type of word will come there. Okay. Now, because I am explaining, it is taking time, but when you are doing it will not take much time. Okay. Next, number 22. Examination showed no sign of a dash. Singular. A is an article. After an article, so you can say article plus noun. A book. So consonant will be there. So what are you expecting? Examination showed no signs of a dash. What is that? No, discomfort will not come. Discomfort will not come. Sign of discomfort, you cannot count it. 1 discomfort, 2 discomforts, 3 discomfort. Discomfort is uncountable. No sign of discomfort, that's all. A is there. That means it is countable. A is there. No sign of a redness. There will not be 1 redness, 2 rednesses, 3 rednesses. No sign of a detachment, 2 detachments, 3 detachments. Examination showed no signs of a. Okay. Try to understand. A is there. Okay. No sign of pain. Is it required a pain? No sign of a pain. There is showed no sign of pain. A pain, is it needed? Pain is uncountable here. Okay. So think like that. Okay, you are getting the words, so you'll get an idea. No sign of anemia. Anemia is uncountable. Opacity, opacity, A and O sounds will not come. No sign of a visual impairment. A visual impairment, an impairment, a visual impairment. Yeah, this may suit, right? A visual impairment. Fine. This is fine, absolutely fine. No sign of a visual impairment. Singular should come. No sign of a complication. A complication. Complications. Okay. Fine, maybe. Right. Next one, 23. 23. Reported increase okay, right, reported increase in number of dash. Number of something. Of is a preposition. Of is a preposition. Reported increase in number of dash. Something. Number of something. So name will come. Okay. So number of floaters. Very good. So what else you can think? Next one. Increased sensitivity to something. Something. Yeah, increased in number of shadows. Okay. Increased sensitivity to dash. So question number 24. Sensitivity to light. Okay. So these are the things. Now what you have to do is you practice tests like this. First you do skimming. You don't know this one. How you will get the answers? You don't know what you have to expect. You don't know what words you have to catch. Okay, if you are ready, then you can catch the answers. Okay. So we have learned a number of things. Now it is there. I am going to play the audio and you are going to answer this. Okay. Right. Right. Now I am going to ask you one thing. I did not have my dinner, but still it is there, no problem. So back-to-back sessions, back-to-back. So now I am going to give a back-to-back session. Okay. So next one will be part B. Are you ready after this? Are you ready for part B? Are you ready for part B? How many of you are ready? Say yes, sir. If there are at least half of the students, I will start the session, continue back to back. Thank you, Dr. Shekhar. You don't know, I'm taking this session specially for you because you are in the United States of, what is this? Not a UK. You're in the UK. Fine. So this session night, I'm taking fully all night session. This is. There are many sessions like this. I have taken for 7 hours together also. Okay. So you are from USA. Okay, fine. Right. So now here, now let us see how many have said yes. Check it out. What's the name? This girl's name, Karuna. Check it out. How many people said yes? Check. Actually, I forgot that Lytia, I don't know what the tonic is there. I forgot at home and I came and I'm continuing. I did not take the medication, that ulcer medication today. Zyte, yeah, I did not. I forgot to take Zyte from home. I took home and I forgot there and I came and I did not use. Okay, no problem. Now it is fine by God's grace. Because it is there in my blood, the teaching. Without teaching, I cannot survive. 2 days I did not teach, no. So I have to bring out that one. I have to compensate for the 2 days which I did not teach. There may be many people who waited for me, sir, like that one. I have the patience to teach, but do you have the patience to withstand the flood? What do you mean by flood here? Flood is an idiom. Okay, flood is an idiom. Yes. So now, so how many yeses are there? 7 so far. Okay, right. 7 so far. Okay. Now coming to the point, I'm playing the audio. Yes, I'm playing the audio. All right. Get ready. Now, how to go to the audio? Many people ask me, I don't understand why they ask me, because they don't even bother to check in the book. Now, see here in the practice book, you have test 3, and this is test 1. You see here, this is Robert Miller, extract 1. This is Jasmine Burton, extract 2. So you can see if you go before, this is saying occupational test introduction, and this is saying test, and before that one you will see audio. See here. See here, automatically finger is pointing. Anywhere it is okay, plus. But if you go here, automatically it point. If you click on this one, on the book here, if you click here, it will take you to www.occupationalenglishTest.org.audio. Why don't you see there? And many people ask me, sir, it is not working, sir, the link, it's not working, sir, how can you find? Oh my God, you start on your internet, na? Just click there. Now it is taking you directly. See, it will go. It is going. Gone. Finished. The website is opening automatically. Huh? That's it. Gone. Okay. 15 seconds. And here is the audio. Test 1, test 2, test 3. 3 tests are there of the book. Now, which test is this one? You see. Now, this is which test? Test 3. That's it. I know. I want you to see. Go to the previous page. Test 3. Confusion. Clarity. Test 3. Click on test 3.
Occupational English Test. Practice Test 3. Listening Test.
Get ready, all of you. Get ready, all of you. Write down your answer in your notebook. Nobody will write here or there. Write in your answer booklet. 13 to 24. Okay, type.
I've got your notes
Type
here,
and
Mrs.
keep
Burton,
it
but
ready. Write and keep it ready. 13 to 24. Write and keep ready in your notebook. Yeah. See, only regular students will come. That is what is the quality of our sessions. Usha is a regular student. Sinimol is a regular student. Hello, Ranjita. Is your sister, a cousin, a friend? I don't remember. Is she there today?
No, sir.
Oh, very sad. But I put it on the YouTube today. Okay.
Okay,
Right.
sir. I will tell.
Yeah. See, Ranjita is a regular student. And most of them are full-time students. Okay. Pradnya, regular student. Karuna, regular student. Joyce. Okay. Evelyn Susan, regular student. Divya D'Souza, regular student. Divya D'Souza.
Yes, sir. Good
Both
evening,
of us
sir.
are mad, no? You and I.
No, sir.
Simon sir, he started teaching something and he's teaching what we don't know. 2 hours gone and what he's teaching. Correct, no?
No, sir. No, sir. I am understanding, sir.
You're able to understand now why you are facing difficulties.
No, sir.
Hmm?
Nice, sir.
Okay.
Class
You want
is
this type of sessions or no?
Yes, sir. We want this type of phone session.
Okay.
With
Very good.
understandable, sir.
Huh?
Understandable, sir.
Yeah, fine. So Divya is a regular student. Okay. Chitra is my student. And Chandrasekhar is my student. Aruna is my student. Anvi Jacob is my student. Okay. So all these are regular students. Fine. So for those who are watching on the YouTube, there are 2 more places for nurses. Doctors, no. I told you, no, only one doctor. Doctor is already come, finished. No more doctors, right? Only if any doctor is going for exam, then I'll give you. But nurses, 2 places are there still. 3 places I advertised, okay? And 2 more places are remaining. Yeah, here it is. Only 2. Nurses only. Sorry. So that is it. So 1 already got. So 2 more places. Just 2 more. Fine. Right. Next. So I think you have written in your notebook now. So now we are ready. I'm making big size. Suffers from dash astigmatism. Also has dash. So surgery. Eye problem. So big so that I can carry on like this for you easily. So that is why I made like this. Okay. So everything will be within your scope and big size and everything. So that's why I made like this. So I took it so size. So it will be easy for you to understand and read carefully. Okay. So there you are. Full screen. So get ready. All of you have written your these things and ready for the test. Okay, no problem, Pradnya, no problem. You are not aware, that's why you asked. It's okay. But what I'm asking is, you have to search before. Always, book is a very special book, so already it will be there. So that's what I try locating. That's very important. Okay, now coming to this. Ready? So yes or no. Come on, fast. Shoot your answer. Yes means Y, no means N. Come on, all of you. I will know who is sleeping. There will be many sleeping people. Just to keep it on and sleep. Because this is night time, na? Yes. Right. So, fine. 1, 2, 3, 4, 5 candidates are participating. Others are not participating. Okay, no problem. Okay, right. So second round, I have to give them, no? So let me know who is participating. Yes for Y and N for no. Right. Ready.
As we're meeting for the first time, could you begin by telling me a little about your eyesight and the treatment you've had over the years? Did you wear glasses? I've got your notes here, Mrs. Burton, but as we're meeting for the first time, could you begin by telling me a little about your eyesight and the treatment you've had over the years? Did you wear glasses as a child, for example?
Yes, since I was about 7. My parents were concerned by the way I held a book when I was reading, so they took me to an optometrist. He told them I had some kind of astigmatism.
Am I right in assuming that's myopic rather than hyperopic?
Well, yes, I'm nearsighted, if that's what you mean.
That's right. Some people actually have mixed astigmatism. They're far-sighted in one eye and near in the other.
Oh, well, that's not me.
Right.
And as well as my astigmatism, as you probably noticed, my eyes flicker. I'm not aware of it myself, but other people comment on it sometimes. I think you call it nystagmus. It meant that when I had my eye surgery, they preferred to use a general rather than a local anaesthetic.
OK, so did anyone ever tell you what they thought might have caused the condition?
Well, I was once told that my generally poor eyesight is most probably down to the fact that I don't have enough pigment in my eye.
Right.
On the whole, my eyes have never really caused me any significant difficulties, however. I've always had to wear glasses, so that's part of life now. I suppose the only thing is that driving's always been out of the question. I'd never have passed the sight part of the test. That's probably a good thing because it takes me some time to focus, which could make me pretty dangerous if I was ever behind the wheel of a car.
Yes, indeed.
Also, I'm useless at sports like tennis. I think that's because I'm poor at judging the distance between myself and the ball. That was a pain as a teenager, but I've never particularly wanted to play since then. And I've hardly had any issues at work because of my sight. I'm a receptionist in a hotel, and I've never had any difficulty reading computer screens or anything, fortunately.
You've had your eyes regularly checked throughout your life, presumably.
Yeah, that's right, every couple of years. My prescriptions changed a little over time, but not that much. Though I certainly couldn't manage without reading glasses these days. About 3 years ago, I was told a cataract was developing in my right eye.
Right.
It was a few years before they decided to remove it. That was this February, and it all went very smoothly.
Good. And you were pleased with the result?
Yeah, I was, thrilled. If only all our failing parts could be replaced so easily. However, when I had the routine checkup a couple of weeks after the operation, I was told there was some clouding. Opacity?
Opacity, yeah.
I think was the word they used. In the capsule containing the new lens. It's a bit disappointing. They could clear it with a laser if it gets to be a real problem, but my flicker makes that rather a risky option. I knew that there's a greater chance of developing a detached retina after a cataract op.
Yes.
But I'm glad to say they found there wasn't any evidence of that in my case.
Oh, good.
All they did was make an appointment for me to be checked out again in 6 months' time. But they said I should get in touch if I felt concerned about my eyes.
And is that what brings you here today?
Yeah, because I am bothered about a couple of things. So firstly, I've noticed more floaters than usual. I
Right.
don't know if that's something to worry about or not. More annoying is the fact that I'm much more troubled by glare than I used to be. So I wanted to ask your opinion on that.
OK. Well, let's start by...
So that's it. Okay, right.
That is the end of part A. Now look at part B.
Fine. Right, now let us see. We're moving to the book, and I'm going to show you the answers. 148, 180. Get ready. I'm not going to show the answers. Don't think that I'm showing you the answers. Okay. Extracted 2. Yes, part A questions 13. Yeah. Ready. Ready. Yes. There you are. Extract 2. Yes, I'll give you the options now. Now we'll get the answers. Okay. Question 13. So, okay, question 13. Now let us see the questions also. Question 13. Be ready? Okay. Question 13. I'll count from 7 to 1. Then you have to submit. Okay. Otherwise, don't submit. Write and keep it. And be careful of capital letters, singular words, plural, one word, two words, word forms, everything. Be ready. Check. Don't just type capital letter. It's a mistake. Write capital letter, whatever it is, it's mistake. Okay, no excuse. Right. Unless and until it is necessary. Okay. Right. Seven, 6, 5, 4, 3, 2, 1, and submit. Okay. Fine. Right. 1, 2, 3, 4, 5 students only. What about the others? What about the others? Are you tired and sleepy and went to bed? Huh? Okay, no problem. So, right, answer. So it is myopic or short-sighted. So myopic, Aruna Lawrence, spelling is mistake. So you lost the mark. Okay. Because this is not medication or difficult word. Okay. So myopic, right? A is not needed. Next one, short-sighted. Short-sighted, or is it near-sighted? That also is there or what? Yeah, near-sighted, short-sighted. Yeah, everything is there. So near-sighted, short-sighted, both are okay. So with or without hyphen, no problem. So normally it is near-sighted is hyphenated, but if you don't write also, it's okay. Ranjita Das, myopic. So spelling mistake. Unnecessarily put a K. Next one, Divya. No. Okay. Now next question. Question number 14. Okay. If it is right, put a tick mark in your notes. Also has a dash. Also has, write and keep your answer ready every time. Okay. 7, 6, 5, 4, 3, 2, 1, submit. One, two, three, four. Okay, fine, no problem. Okay. Anybody else? 1, 2, 3, 4, 5. So only 5 people are participating. Okay. Next one. Okay. At least put it in your notebook, tick marks. Please. So next one is 15. Question number 15. Lack of dash. Eye problems may result from a lack of dash. Okay. 7, 6, 5, 4, 3, 2, 1, and submit. Oh, 15th I told, but I did not tell you the answer for 14th. Huh? Okay. No problem. You type. So 14th answer. 14th answer is yeah, 14th answer is nystagmus or flicker or flickering or a flicker or a flickering, all are right. Nystagmus flicker. So that is 14th. 15th answer. Pigment or pigment in eye. Okay. 15th answer. Okay. Pigment or pigment in the eye. Fine. Next. Question number 16. 7, 6, 5, 4, 3, 2, 1. Submit. Okay. So 16th. Yeah. Driving is the right answer. Then 17th. Okay. 17th. Reports some slowness to dash. 7, 6, 5, 4, 3, 2, and 1. Submit. Pigment is singular, pigments is plural. If you add S, it becomes plural. Okay. So 17th answer. Okay. What is the answer then? Singular or plural? Pigment. Pigment in eye. Okay. So let us see there. A lack of. A lack of. A is already there. A lack of any pigment. Okay, pigment. Just pigment is enough. Okay, next one. So next question is which one? 17, 18. So 18. Okay, but before 18, 17th answer I have to give, no? So 7, okay, 17th answer. 17th answer is focus. What happened only? Okay, they have written here. Okay. Next one is 18. 18. Has poor perception of dash. Has poor perception of dash. 7, 6, 5, 4, 3, 2, 1. Submit. Okay. Right. Distance. Next one, 19. 19 works as a dash. Works as a dash. 7, 6, 5, 4, 3, 2, 1, and submit. Submit. Okay. Receptionist or hotel receptionist. Receptionist or hotel receptionist. Anything is okay. Right. Next one. Dash in right eye. So 20. 20. Dash in right eye first noted 3 years ago. 7, 6, 5, 4, 3, 2, 1. Submit. Okay. Cataract. Cataract is the correct answer. Okay. '21. Some capsular dash noted post-operatively. Some capsular dash. 7, 6, 5, 4, 3, 2, 1, and submit. Now you will be knowing why it is right and why it is wrong. Okay, reason. Okay. So 21. Opacity or clouding. Both are right. Both are right. Next. 22. 22. Examination showed no sign of a dash. Examination showed no sign of a dash. 7, 6, 5, 4, 3, 2, 1, and submit. What about the rest? I sent only to one. Okay. No capital letters, please. No, okay. Computer, but take care if possible. Okay. 22. 22. 22 is detached retina or retina detachment. Just a detachment is not right. Detached retina or retina detachment or retinal detachment. L if you don't write, no problem. But retina you must write. So Divya, you lost the mark, Divya. You lost the mark. Okay. Next. 23. See here, writing. I did, follow-up appointment in 6 months has been scheduled. Now you understand? So this is important. They should not separate this one. Scheduled in 6 months is wrong. In 6 months has been scheduled like that. So 7, 6, reported increase in number of dash. 5, 4, 3, 2, 1, submit. Ranjita, is that the correct spelling you have written? Check it out. If it is wrong, wrong only. Okay. Okay. The answer is eye floaters are just floaters. Eye floaters are just floaters. So next. 24. Increased sensitivity to dash. 7, 6, 5, 4, 3, 2, 1, and submit. Deva. Yes. So write the answer. Increased sensitivity to dash. So, right. Now let us see the answer. Glare or bright lights, not just lights. Bright lights, glare. Lights are lights only. Bright lights is called glare. So that also plural. So if you just write lights, it is not right. So now let us see. Karuna right, Divya wrong, bright lights, Pradnya right, Usha right, Ranjita wrong, Evelyn right. So now, total score. Okay, out of 12. So type and keep it ready. Type and keep it ready. Oh, Pradnya, 12 out of 12. Very good. Okay, 5, 4, 3, 2, 1. Submit. Aruna, you would have lost me. Huh? Hello, everyone. Yes. Aruna Lawrence from the UK. How are you? Unmute. Okay.
Yes, sir.
How are you, Aruna?
Sir, fine, sir.
Flooding? Flooding is happening or no?
Sir, I did not get you.
Flooding is happening
Yeah,
or no?
sir.
Flood.
Yes, it's happening, sir. I'm waiting for part B also.
You are waiting. No, you don't want, no. You were about to lose me actually. Huh? You were
No.
about to lose me actually, and you will never get this anywhere. Do you think you will
That's
get
why
these
still I'm in track, sir. I came
things?
to
Do you
you.
think you will get these things?
No.
Definitely no. Because that is what our training, na?
Yeah.
Okay.
Yes, sir.
You go to nurse, they cannot explain all these things. Because this is subject. This is not nursing. This is English. Okay. So right. Okay. Now, so how many of you got a 12 out of 12? Then 12, 1, 2, 3. So how many of you got 12 out of 12? Check Karuna. 12, how many students got a 12? Sorry, 12. How many students got 12? 2 students got 12. Huh? 2 only. I saw 3 direct first starting itself. Pradnya 12, Evelyn 12, Karuna 12. 3. Then again, okay, 11. 1, 2, 3, 11. Okay, Cinemol 11. Hello, Cinemol. Unmute.
Yes, sir.
Oh, how you got 11?
By
I
your
can see the difference.
yes, sir. Yes, sir.
A lot of difference, right?
Yes, sir. Yes, sir.
See how people are standing for so many hours and learning things, right?
Yes, sir.
So if you practice like this, some sessions, it will be very easy. So definitely. Now,
Yes, sir.
all of you, yeah, you can mute back. So, feedback about the session. So how it was useful? Okay, first I want to ask you one thing. Don't write anything. 0 to 10 scale. Okay. Efficiency rating. Efficiency of techniques. Efficiency rating of what you learned. How fruitful it was. Learning process. Teaching, learning, teaching learning process. Teaching learning process efficiency rating. So 0 to 10 scale, what score you will give for what you learnt now? No need, buttering. Frankly, you write what rating you can give. No need. If you tell 0 also, nothing effect for Simon sir. But what I'm telling you is how it benefited you, not for how was the lesson. I am not asking how much you got benefit. Did you get 100%? Because you cannot say 100% benefit you got. You cannot say 100% benefit you got. How much you learned, how much you can gather. Okay. Maybe you missed some points or missed some things or whatever it is. So how much percentage you got? So that is 0 to 10 scale. So you can give 5, 4, 3, 2, 1, submit. Now, next point is what are the best things? What are the best points in today's session? What are the best things in today's session? I mean the listening session. So you can write, this was excellent, this was excellent. Okay. For example, explanation was excellent. We are able to understand very well. What are the best things for today? Write down. What were good so that we can use them. For example, explanation. Wide range of vocabulary or discussion is excellent. Sir, you made us write all the vocabulary words. So like that one. What all you feel, what are good you felt? Active participation or counting and making you write all at the same time, 7, 6, 5, 4, like that, and submitting. So like what are the good things? You can write down. Prepositions need to be discussed more. Yeah, we'll discuss. This is just the first session. We'll discuss. Those suggestions we'll take afterwards. Okay. What all new things you have learned? Positive things you write. This is called constructive criticism. Which is good, you will say good. Which you want to improve, you have to improve. Dilam Chakuda from Sri Lanka. Yes. So is that all? Yes. So next one. Okay. Now what more are you expecting? Next question is what more? Okay. What more are you expecting? So that's nothing negative, all positive only. What more are you expecting from these sessions? Okay. You can tell, sir, what all you expect more? You can write. Okay. So you can write your points. What more you want me to explain? You can write whatever you want, so that I'll keep in my mind next time. Time saving, you mean time saving in Simon Sir's lecture or time saving in the exam? It's ambiguous question, so I'm asking. Ranjita, time saving in the lecture fee time, so don't take this much long sessions, sir. Is that what you want to say, or you want to save time in the exam? A little more. Okay. There is only one girl, Rakhi Ravindran. She does the test every day and she submits the test. Good. Right. So these are some requirements. Okay, what more are you expecting? So it is here. Okay. Good. Yeah. So maybe I will take part B. We'll see. So now the question is, okay. Right. Now I want to ask you the last question. What is the difference you notice in our sessions? Okay. What is the difference you notice in our sessions? Okay. When you compare, okay, comparatively, that means comparatively. What is the difference you notice in our sessions? I notice only one thing, I'm wasting your time. That's it. Okay, what is the difference you notice in our sessions comparatively? Yeah. What you noticed in our sessions, especially, which you did not notice elsewhere. In general. So you can write what you noticed. You might have noticed one particular thing. Simon sir is always shouting. He doesn't bother about the students. He doesn't give value to students' time. He can take less time and leave them, no? Okay. He always behaves like a dictator. He doesn't allow anybody to talk also. He says question answer session. Yes, now it is coming. Question answer session. Mute all. Yes, you can all unmute. Not now, when I tell you. Okay. Yeah, if anybody has a question, you just type. So question. So question, if you have any question, so then what you have to do is, you say, I have a question, or just type question, or Q, just type Q, that's all. Then I'll give you preference. I'll give you the mic. Okay. I'll give you the mic. So anybody, if you type question answer session now, 5 minutes, maximum 10 minutes. If you have any questions, you can ask.
I have a question. This class is for listening part B and C or part A?
This is for part A, which will go into part B and part C also. What I taught now is exclusively for part A, but the techniques will travel for till part B and part C also.
Okay.
Okay.
Yes.
The example we took is for part A, but the techniques I taught you taking so much time. Why? Because they will be carried on to part B and part C also, and some addition should be taught in part C and lot more in part C. This is gear 1, that is gear 2, that is gear 3. We are in a car and Mr. Simon is the pilot. Gear 1, gear 2, gear 3. That's it.
Very good.
Yeah.
Thank you.
Anybody else? Anybody else has any questions? You can type Q or you can unmute. Okay. If not, now I have one option for you, two options for you. Now, close this, session of the workshop and continue with the new one. Okay. Close this session and start a new session. Number one. Or number two, leave it open and resume. What do you think? Shall I give you a new link or stay here itself? What do you say? So option A is continue in the same link. B, new link. If I close this video, I'll give you a new link. Or if I keep it open, it will continue. Which is the best? Dr. Sekar. B. What about others? B. Majority vote. Come on, come on, come on. Okay. Karuna, tell me, what are the count? How many B's and how many A's? Okay. So now, what I want you to do is, okay, all of you can have your dinner. Okay, I'll close the link, decided, because of the, okay, new link will be provided. New link will be provided. The gap, okay, the break. So how much time will take? 30 minutes or 45 minutes or 60 minutes, because we are going to stay long. So I have a heavy thing. Now the option 30 or 45 or 60, write anyone. 30 or 45 or 60. You write. Majority vote. Pradnya says 50 minutes. You are simply sitting and listening. Pradnya, very clever, Pradnya. I did not give the option only, so you lost because you have given out of the topic. Multiple choice only A, B, C. You are taking D, so you are lost. Come on, come on, come on, come on, fast. Yes. So majority vote goes for 30 minutes. Agreed. So 30 minutes, I'll have my dinner and we'll join with a new link. Now it is 12 o'clock midnight in India. So we'll join at 12:30. Fine. We'll join at 12:30. So the topics will be part B. Afterwards, if strength is there, part C. Otherwise, we'll do part, what is that, part B half. Okay. Part A half we done. Part B half, 3 questions we'll do. Part C half we'll do, no problem. That's better. Okay. Those who are going and not coming, for them, good night. Okay. So remaining people, just the wait. Okay. Yes. Copy.